there's really no room for paternalism, that you may not perform a procedure, but as a physician or a medical provider, it is incumbent upon you to know about the procedure and
Right.
not sort of myths and truths, but rather the real basis of the procedure, the pros and cons, and that if a patient is asking about it, and even if you don't perform it, you shouldn't dismiss it. You
Hmm.
should know enough about it to say, well, that could be an option. I've heard it being used in these circumstances. I don't necessarily do that, but I know of places and physicians who do, and it would be worthwhile if you feel to go, feel that way, to go and either talk with them or do a telephone consult or a video consult. I mean, those things are easy enough because the majority of us who do these procedures, we're excited to talk about it. So
Mm.
even if you wanted to pick up the phone and say, hey, I'm interested in RFA, what do you think? We're going to spend time with you, talking to you about it because that's
Hmm.
what we like to do. So I'm very hopeful that people won't be so patronizing, paternalistic about these aspects, and that physicians should really try to remain without bias
Right.
and really use objectivity in the discussion with their patients and say, quite frankly, I don't do this and I don't know enough about it to give you any real meaningful information to make a decision, but I'll find out for you who can. And I would say that's probably who you would want to talk to, at least get some information. It's just so disappointing to me that that happens. And then,
Yeah.
the patients don't know any better and they say, well, I guess I'm not a candidate, or maybe it is kind of hokey. And all right,
Yeah.
well, I asked about it and that's it.
That is one of the biggest obstacles that I'm trying to empower patients to be able to see past the fact that their doctor may not know. They just can't advise them on what they don't know. And
Right.
so if they receive that sort of opinion from their doctor, to consider just on their own seeking out the opinion of an RFA doctor who does know,
Right.
and then getting that, that informed opinion from that doctor. So.
Right. And so, your group and what you've started is really powerful in that way, because then you can help educate these prospective patients, or at least to get some direction on where to go next. Like they're
Yeah.
lost. Once your doctor tells you, oh, that's not good, or you're not a candidate, you're kind of stuck,
Yeah.
right? Where are you going to go? Because that's a person you really respect. That's who you've gone to for information. That's a
Hmm.
person that if they tell you it's kind of hokey, then you're like, well, I guess it's hokey.
Hmm.
So, I think breaking down those barriers and having a group like yours where there is a very supportive and educational aspect to it, that's really critical. That helps because, look, it takes time to find your way otherwise, and you may or may not, by sheer luck, get there, or, you may get there, but you may not. So that's why your group is incredibly important to talk about experiences, say what you've been through, your experiences of even trying to find a doctor. Like, how do you even start with that? That
Hmm.
it's really helpful and it's really powerful, and I'm glad that you are doing that.